Hello friends, this video is about a day-to-day well-known ingredient of our food, that is garlic. And at the end of this session we will be able to know many new informations about garlic, and let's go on into our discussion today. We all know that India is a country of spices, and it is in India that we discovered many spices like pepper, cardamom, and so on. And we all will remember the irresistible aroma of the roasted garlic which our mothers used to cook in the kitchens. And we all know that garlic adds a flavor. It's a flavor booster in curries and dips of various fries and toppings in pizzas and pastas. We all would have also seen or heard of our grandmas and grandpas telling about the use of garlic, which they use for their knee pains, or they add as an ingredient in hair oils for good hair growth and all. We would have also thought that it is one among the myths and beliefs of them, but there is always a science behind our ancestors. Now, this garlic is botanically called as Allium Sativum. It belongs to our onion family, and it is a bulbous type with 10 to 20 sections per bulb, and each section is called as cloves. This garlic has various contents like allicin, arginine, L-allyl mercaptocystine, selenium, thiacrymonone, diallyl sulfide or diallyl disulfide. All these ingredients together make what we call the garlic, and there are a lot of scientific as well as medicinal uses of all the contents of garlic. Now, looking upon one by one, the main use of garlic is that it protects the individuals from cardiovascular diseases because it prevents the atherosclerosis, which is the main basis for cardiovascular complaints. This garlic it prevents by reducing the lipid contents in the arterial membrane, and thereby protecting the individuals against cardiovascular risk. Another main use of garlic is that it acts as an antioxidant which helps in the good health of hair and skin by preventing the free radical damage. That is why our grandmas used to add crushed garlics and onions in the coconut hair oil that is being used in even nowadays in Kerala and some parts of southern Tamil Nadu. Now, the next use is about the hypocholesterolemic effect of garlic. This is not just saying or just for the sake of speech, but this is a proven study by Reddit et al. And in 2013. It is actually a meta-analysis of 39 primary trials with 2 months of garlic administration in the people. In them, it is noted that the total cholesterol level reduced by 17 plus or minus 6 milligram per less deciliter, and the LDL, that is the low density lipoprotein, which is also playing an important role in various cardiovascular diseases, stroke and so on, has also reduced by 9 plus or minus 2 milligram per deciliter. On the whole, it showed that there were 8% reduction in total cholesterol and 38% reduction in risk of coronary events at 50 years of age. And another one new and astonishing effect of garlic is that it prevents thrombosis. There are proven evidences and trials that it inhibits the ADP activated platelets binding to the immobilized fibrinogen. This process is very essential for the platelet aggregation and formation of clot when there is any bleeding episodes anywhere in the body. So this garlic, the contents of garlic, that is mainly the allicin, it helps in preventing the GP2B3A receptor and increases the cyclic AMP. This is proved by study of Ellison et al. In 2012. Also, there are evidences that it reduces the thromboxane A2 synthesis, which is also a potent platelet aggregator. And there are various hypotheses that it helps in anti-tumor action, such a way that it inhibits the carcinogen activation, enhances the detoxification, reduces mitosis of tumor cells, reduces histone deacetylase action, increases acetylation of H3 and H4, inhibits the cell cycle at G2M phase, which was studied by Capasso et al. In 2013. Another important content of garlic, that is aegeon, as we saw earlier, is actually present in garlic stable oil, and this induces the apoptosis of leukemia via peroxide production by activation of caspase 3 and caspase 8 like activity. Garlic also has anti-diabetic effect. Although not proven in humans, it is being done and proved in animal models. It also has antimicrobial effect, and it is even bacteriostatic for vancomycin resistant enterococci. It also has antiprotozoal, antiviral, antifungal and anti-arthritic actions when applied topically. Now, coming upon to the doses of how much an adult should eat on average per day is 4 gram, that is 1 to 2 clove, and most important, it is not as dried or any content of any curries or something. It is like 1 to 2 cloves raw garlic per day. Or there are also several processed forms of garlic, that is garlic powder or garlic extract. If we take as a garlic powder, we have to take 300 milligram dried garlic powder tablet 2 to 3 times per day, or 7.2 gram of aged garlic extract per day. But since we readily get garlic in our places, it is better we can take a raw garlic of 1 to 2 cloves per day, that too in an empty stomach, along with a small piece of garlic. And for flavor, you can add some vitamin C contents like gooseberries, all mixed in a thick semi-solid form as raw. And this also helps to boost you a good energetic drink in the early morning. People who go for walking and all can take this drink before walking and can find their difference in the day by yourselves. And there are also some precautions that we have to keep in mind before taking garlic. Although it has many good uses, the main important and well proven effect is on the platelet aggregation. So the people who already have the bleeding tendencies, or people in whom the bleeding tendencies should be stopped at least for some days, like in case of some major surgeries or some a major like a delivery or something, the people should avoid taking too much of garlics for 1 month past their procedure, or at least 1 week before their procedures. And nowadays, since there are many new technologies available for platelet donation or plasma donation and so on, the people should avoid garlic, at least too much of garlic in their diet at least 24 hours before such procedures. And it is best to avoid totally for people with bleeding tendencies as such, like hemophiliac patients. And that's all about garlic, and I hope you all enjoyed this video and gathered some new information with evidences. Thank you for your support. Keep supporting